Dr. Lee, let's talk a little bit about missing teeth. And I'm mainly talking about missing teeth in the back of the mouth. Since usually when people have missing teeth in front, well, it looks ugly and they go to a dentist rather fast. But here's what I want to know from you. Dentists always keep telling us that if we have missing teeth, we need to replace them fast. Otherwise, all hell breaks loose. At the same token, as patients, we quite often have missing teeth for years in the back. And it doesn't look like anything bad is happening. So why this hurry? Why these emergency statements? They seem to be literally contradictory. Shed some light on it.
Okay. Well, you're right. A lot of people, if it's in the front aesthetic areas, they're going to be going to the dentist right away to get it fixed. If it's in the back, people decide, okay, I just need to chew a little bit differently and I'll be okay. Well, what happens is first people start chewing they might chew on just one side only, or they end up chewing on teeth that aren't made to support certain chewing functions. So other teeth might tend to break down more, or your jaw joints, they might get affected because you have to shift your jaw a little bit differently to chew. The other thing is all the teeth that, when you have a tooth that's missing, the other surrounding teeth from top to bottom, front to back, they're going to all start to migrate towards that space. Teeth aren't made to...
So they start shifting eventually.
Yes, everyone's going to get a shift. Teeth have a tendency to move until they're touching something. So what happens is, teeth, they start to tilt and tip, and they're not made to function when the tooth is tipped. You want to get the forces of the biting to go straight down the root, not along the side of it. So not only do you start to get more detriment to those teeth, you'll also start to get more gum problems around them, because as the teeth start to tip, they start to create a lot more bunched up tissue that you might start to get gum disease around. A lot of people adapt to the change because it is a really slow process. And a lot of dental problems are not going to cause pain until they're really more advanced. So, you want to always try to prevent certain problems. If you wait till they're already big, it becomes a lot more detrimental to, your overall oral health. The other thing people don't really know too much is that when you start to have missing teeth, you start to get little deflections in the way your bite becomes. So you start to get a bad bite. Some people who are more susceptible, they start to get joint problems, and now they end up needing TMJ therapy.
Okay. Well, let's get this a little bit in perspective here. Let's see whether I understood what you said. So first of all, teeth slowly but surely seem to be moving, and like a bad fence where like one ball is missing and then another fence ball gets crooked, so it loses its function and also starts looking ugly. The ugly part isn't maybe so bad because it's in the back, but nevertheless it loses its function. So you say, and you mentioned we talked about gum disease, how devastating that is to not just because you have a stinky mouth, but because the liver, the kidney, the heart, diabetes, all kinds of things get affected by it. So because you have a harder time cleaning, is that what it is? Because the teeth are crooked, so more it ruins the sockets around the gums and the bones. That's basically what you're saying, right?
Yes.
To a certain degree, in a layman's language. Then, so basically you can get that degree. Yes, you have the chewing problems. Most people, somebody like me, would kind of like care less, because like for instance, when my wife and me sit down eating, she has her first 2 leaves of salad still in the mouth, and I'm finished with the steak. So whether I would have a tooth or not, it wouldn't probably matter very much. Do you know what I mean? So, but the point is, it is there. And then you said, this is very interesting what you said, the last thing here. Because of the crooked teeth in it, you start chewing different, no doubt about it. And even though you adapt the muscles around and the hinges, basically, I come from a mechanical background with machinery and stuff. And if a cogwheel is bad, crooked or missing or whatever it may be, hinges are missing, so to say, eventually the machine comes to a grinding halt. And in a person, I guess that means muscles and everything is tense. And is that maybe where some people, some dentists and some doctors say that that's how you get headaches, shoulder pain, neck pain, even back pain, migraine, and all kinds of stuff, because your jaw is basically out of alignment?
Right. And, if you were to go to a chiropractor and they would see that you're out of alignment, maybe a podiatrist or someone else, they might see that, your feet aren't balanced, so your legs are off kilter, your hips are off, your shoulders are off, and that's why you're having all the pain in your back, your neck, and your head. Well, it's easy to see those big problems, because when you look at yourself, your posture's off, your shoulders off, everything's off. In the mouth, it's the same thing. The teeth, they're going to be supporting your jaw joint. And if your jaw joint isn't properly, centered and properly held together, then, your muscles have to work differently. Your jaw joint has to work differently. All the muscles around your head, neck, and even shoulders, they start to become affected. So people start to have these debilitating problems where, over time they're starting to get headaches more. They're taking more pain pills. They're going to the doctors because they have migraines, and no one can figure out what's going on. And, it all stems from the teeth. So, it's really, it's easy to see the whole body as a whole if you're off center, but a lot of people don't consider the mouth.
Right. It is, after all, whoever created us, let's call him God at this moment, but it is quite amazing. He did put lots of important things into that little head up there, right?
Yes.
You have the eye, you have the nose, you have the brain, you have the ear. Why would he put something unimportant in it with it, right? Most likely not, and he didn't. It's really like, and I can understand from a mechanical viewpoint and with the way you explained it with chiropractor and thing. In fact, many dentists, and tell me whether that it's true, looks to me it is true, when they adjust a person, when they do the bite, as you called it, when they straighten it out and the headaches go away, they still quite often tell the person, also go to the chiropractor, go to a podiatrist, even depends on, to maybe an acupuncture, because for so long your muscles have been so out of alignment. Let's just say a bad leg can throw out everything all the way up to the head, and a bad mouth can throw everything up all the way down to the dough. So everything needs to be slightly realigned and the muscles made soft and stuff. Is that true?
Yeah, definitely. The head, everything from the neck above, it's a very complex process. And there are certain patients we've had where they might have had a few crowns placed, not even a whole lot. And it's enough where if the bite isn't adjusted properly, you start to get shifts in the jaw. And from that point on, they start to have a lot of severe problems that no one can seem to figure out why they're having those problems.
Like a Swiss watch. That's why they call a Swiss watch, because it is so beautifully aligned. And missing teeth is a cause. I'm sure it's not the only cause to that whole stuff, but it's definitely a cause. So would you suggest that a person who had missing teeth for a while, maybe has headache, shoulder pain, neck pain, back pain, has gone to a chiropractor, got some help, but kind of came back, got help, came back, would you suggest that he goes to a qualified dentist and say, look, can you check my mouth because somewhere along the line I'm having headaches? Would you say that's a good thing to do for a patient?
Yeah, definitely. A lot of people don't realize that having that bad bite can cause all those problems. Now, you'd have to make sure that that dentist is qualified to actually check the bite properly, has a proper training. Like I said earlier, you can have a dentist who decides they only want to do fillings the rest of their life. And then you have other dentists that decide they want a lot more training and they want to be able to help the person more as a whole. So be sure they have the proper training to be able to distinguish those problems.
Right. Probably also some of the proper equipment. Thank you very much, Dr. Lee. Very candid.